Acne medication is of different types. You may have topical or oral medication. The medication may include antibiotics, retinoids, antimicrobials, etc. Acne medication is of different types. You may have topical or oral medication. The medication may include antibiotics, retinoids, antimicrobials, etc. During pregnancy, one has to be extremely careful before applying or oral intake of any medication. Some medication cause birth defects in the fetus and some are dangerous for breastfeeding child. Please take any medicine or apply any medicine after talking to your doctor if you are planning pregnancy, you are pregnant, or while breastfeeding your child. Please avoid every type of vitamin A derivative, either topical or oral. Medications such as isotretinoin, which is one of the favorites of acne medicines, should be strictly avoided. Other topicals containing tretinoin, tazarotene, and other vitamin A derivatives should be strictly avoided. Please don't use any topical skin care product before asking your doctor. Please avoid any oral medication after talking to your doctor. Many OTC skin care products contain vitamin A derivatives. Please avoid all such products. Please avoid antibiotics from the group of tetracycline such as tetracycline, doxycycline, etc. They may damage the fetus or breastfeeding child. No antibiotic should be taken innocently. Please avoid any hormone preparation that you may be using for your acne. Many hormones such as estrogen and other anti-androgen hormones can damage the fetus and also get passed to the breastfeeding child. Avoid as many medicines as possible. Avoid all skin care and makeup products. Get everything certified by your doctor if you are planning to get pregnant, or are pregnant or breastfeeding your child. Acne medication, research of side effects. Whilst medications are vital in the treatment of a significant number of conditions aside from acne, it is always wise to research the medication to allow a balanced approach or weighing up the benefits prior to commencing. This is obviously extremely clear in the case of the drug isotretinoin for severe acne. Acne is an extremely common skin affliction affecting around 85% of teenagers and young adults as well as a significant proportion of adults. With a plethora of acne information available, it may also be difficult to establish what is the right treatment and/or medication. In a previous article, one suggested that as all of us are individuals, it is likely so too will the treatment for each person's acne. Let's delve a bit further into treatments and medication. In the case of mild or even slightly worse acne, a good preventative and treatment regime, if rigorously followed, is often found to control the affliction. However, there are obviously sufferers with severe acne where over-the-counter or non-prescription treatments have not had the desired impact. Whilst I would suggest in this instance finding a reputable dermatologist, you will likely find that an acne treatment regime still has a place in assisting the overall treatment. It would be extremely advisable for those prescribed medications for the more severe acne affliction to carefully research the medication prior to commencing. The clear example of this is the medication for recalcitrant nodular acne, being isotretinoin, marketed as Accutane, Amnesteem, Cravos, and Sotre. The U.S. Food and Drug Administration provides significant information in relation to this particular drug. However, in short, it is known to cause birth defects and is being examined in relation to reports of suicide or suicidal thoughts associated with the use of the drug. A risk management program called iPledge in relation to this drug is in place with information and updates available. The program is ensuring adequate controls are in place in relation to the use of this drug, and the important message is, do not purchase this drug over the internet. There are a range of prescribed medications available, with those applied to the skin for more mild to moderate cases and oral medications for more severe. Some of these include oral antibiotics, oral contraceptives, azelaic acid, benzoyl peroxide, clindamycin, erythromycin, sodium sulfacetamide, tazarotene, tretinoin, adapalene. The message is still, however, to do the appropriate research, as information on some drugs may change significantly over time. Whilst medications are vital in the treatment of a significant number of conditions aside from acne, it is always wise to research the medication to allow a balanced approach or weighing up the benefits prior to commencing. This is obviously extremely clear in the case of the drug isotretinoin for severe acne. Acne medication from your dermatologist. You may decide that your acne problem is serious and wish to consult a dermatologist. Before visiting a dermatologist for the first time, it is good to know what to expect, especially in the type of acne medication that he or she is likely to prescribe. While seeking treatment, your dermatologist may prescribe you with more than one type of acne medication. This can be normal as acne is usually assessed on a case-by-case basis. Therefore, acne medications that work for another does not necessarily imply that it will also work for you. Depending on the seriousness of your acne problem, your dermatologist may be prescribing you with a topical acne medication and/or a systematic approach to reduce the cases of flare-ups and inflammations. A topical acne medication treatment is one that is applied on the skin surface. It can come in different forms, for example, lotions, gels, soaps and creams. Benzoyl peroxide is a common ingredient in the majority of acne medications as it helps in slowing down the activities of the oil glands in producing skin oil called sebum. However, continued use of this acne medication may cause the skin to dry and crack up, plus a possible irritation and burning sensation may be felt. But this can be resolved pretty easily through minimizing the level of usage of benzoyl peroxide. It is important that this product is used over the infected area, not just directly to one or two individual pimples. Smearing and flaking are likely to carry the infection to other parts of the skin, like the back, shoulders and neck. So you have to be careful when you apply this product. Retin A, a derivative of vitamin A, is not a topical acne medication, but it is noted to show great effects on the growth of acne. It works by drying the skin, thus preventing new pimples from developing. However, it is suggested that if you should use this, you must at all times stay away from the sun, as this may only aggravate the skin condition. Meanwhile, systematic acne medication is one that is taken internally to combat acne. It usually comes in the form of antibiotics. The type of antibiotic that you may use will depend largely on the severity of the case and your skin type. At times, you may be prescribed to use small amounts of antibiotic contents like that in botulinum and many over-the-counter acne medications. On the average, these acne medications may take 6 to 8 weeks before significant developments take effect. In certain cases, your dermatologist may prescribe you with hormonal acne medication treatment. The principle in most hormonal treatments is to control the release of hormones such as androgens and testosterone. This happens when the dermatologist decides that hormone imbalances is the cause of your acne. Of course, it is always best to get a professional and qualified skin specialist or dermatologist for a proper diagnosis. Choose one that comes highly recommended by your friends and relatives. Spend time to search for a good dermatologist. Acne medication potential side effects. Patients with mild or occasional acne may be able to treat themselves without the use of prescription medication. Such remedies may include an alteration in diet and exercise habits, regular cleansing to remove residue and buildup on the skin, choosing the right cosmetics and eliminating stress. Patients with mild or occasional acne may be able to treat themselves without the use of prescription medication. Such remedies may include an alteration in diet and exercise habits, regular cleansing to remove residue and buildup on the skin, choosing the right cosmetics and eliminating stress. But for some individuals, this simply isn't enough. For those who suffer from moderate to severe acne, a stronger medication may be needed in order for that individual to find relief from their condition. There are several different types of medication that are commonly used to treat acne, each of which may contain the potential for certain side effects. As is the case with most over-the-counter acne medication, prescription medicines are usually available as gels, creams, lotions or solutions. In determining which is the best choice for the patient, a physician will study the skin type, severity of acne and the patient's likelihood of having a negative reaction to any medication. Once a prescription is written, the physician will explain how often to use the medicine and how to properly apply it to the skin. As mentioned previously, it is not uncommon for individuals to have a reaction to strong acne medication. For some it is only temporary, but others may require a change in their prescription. The most widely seen reaction is that of the skin's condition actually worsening. Many physicians agree that most medications will cause the skin to worsen before it actually improves, which may take 6 to 8 weeks of using a medication. However, additional side effects may include extreme redness, burning, stinging, peeling, soreness, scaling or a discoloration of the skin. If individuals notice these side effects becoming increasingly worse or if they do not go away after a specified period of use, which should be indicated by a physician, the medication may need to be changed. Individuals who take oral medications for the treatment of acne may face an entirely different set of potential side effects, including an upset stomach, dizziness and skin discoloration. Certain types of medication can be dangerous to women who are pregnant or children under a certain age, so individuals should report any possible conditions to their physician prior to accepting a prescription. As with any medication, there are often risks and benefits of its use. The best way to learn of these is to speak with a physician, ask about any potential side effects and completely disclose your current medical condition and any medications that you are currently taking. In some instances, medications may negatively react with one another and this can be very dangerous to the patient. Acne medicine is no different and the patient should have a complete understanding of how it operates before using it. The information in this article is intended for informational purposes only. It should not be considered as, or used in place of, medical advice or professional recommendations for the cause, diagnosis or treatment of acne. If necessary, individuals should consult a medical doctor or dermatologist for information regarding the use of acne medication or other effective treatment methods. Acne medications. Read this medication guide every time you get a prescription or a refill for Accutane, Accutane. There may be new information. This information does not take the place of talking with your prescriber, doctor or other health care provider. What is the most important information I should know about Accutane? Accutane is used to treat a type of severe acne, nodular acne, that has not been helped by other treatments, including antibiotics. However, Accutane can cause serious side effects. Before starting Accutane, discuss with your prescriber how bad your acne is, the possible benefits of Accutane, and its possible side effects, to decide if Accutane is right for you. Your prescriber will ask you to read and sign a form or forms indicating you understand some of the serious risks of Accutane. Possible serious side effects of taking Accutane include birth defects and mental disorders. Number 1. Birth defects. Accutane can cause birth defects, deformed babies, if taken by a pregnant woman. It can also cause miscarriage, losing the baby before birth, premature, early birth, or death of the baby. Do not take Accutane if you are pregnant or plan to become pregnant while you are taking Accutane. Do not get pregnant for 1 month after you stop taking Accutane. Also, if you get pregnant while taking Accutane, stop taking it right away and call your prescriber. All females should read the section in this medication guide. What are the important warnings for females taking Accutane? Number 2. Mental problems and suicide. Some patients, while taking Accutane or soon after stopping Accutane, have become depressed or developed other serious mental problems. Symptoms of these problems include sad, anxious, or empty mood, irritability, anger, loss of pleasure or interest in social or sports activities, sleeping too much or too little, changes in weight or appetite, school or work performance going down, or trouble concentrating. Some patients taking Accutane have had thoughts about hurting themselves or putting an end to their own lives, suicidal thoughts. Some people tried to end their own lives. And some people have ended their own lives. There were reports that some of these people did not appear depressed. No one knows if Accutane caused these behaviors or if they would have happened even if the person did not take Accutane. All patients should read the section in this medication guide, "What are the signs of mental problems?" For other possible serious side effects of Accutane, see "What are the possible side effects of Accutane?" in this medication guide. What are the important warnings for females taking Accutane? You must not become pregnant while taking Accutane, or for 1 month after you stop taking Accutane. Accutane can cause severe birth defects in babies of women who take it while they are pregnant, even if they take Accutane for only a short time. There is an extremely high risk that your baby will be deformed or will die if you are pregnant while taking Accutane. Taking Accutane also increases the chance of miscarriage and premature births. Female patients will not get their first prescription for Accutane unless there is proof they have had 2 negative pregnancy tests. The first test must be done when your prescriber decides to prescribe Accutane. The second pregnancy test must be done during the first 5 days of the menstrual period right before starting Accutane therapy, or as instructed by your prescriber. Each month of treatment, you must have a negative result from a urine or serum pregnancy test. Female patients cannot get another prescription for Accutane unless there is proof that they have had a negative pregnancy test. A yellow self-adhesive Accutane qualification sticker on your prescription indicates to the pharmacist that you are qualified by your prescriber to get Accutane. While you are taking Accutane, you must use effective birth control. You must use 2 separate effective forms of birth control at the same time for at least 1 month before starting Accutane, while you take it, and for 1 month after you stop taking it. You can either discuss effective birth control methods with your prescriber or go for a free visit to discuss birth control with another physician or family planning expert. Your prescriber can arrange this free visit, which will be paid for by the manufacturer. You must use 2 separate forms of effective birth control because any method, including birth control pills and sterilization, can fail. There are only 2 reasons you would not need to use 2 separate methods of effective birth control. 1. You have had your womb removed by surgery, a hysterectomy. 2. You are absolutely certain you will not have genital-to-genital sexual contact with a male before, during, and for 1 month after Accutane treatment. If you have sex at any time without using 2 forms of effective birth control, get pregnant, or miss your period, stop using Accutane and call your prescriber right away. All patients should read the rest of this medication guide. What are the signs of mental problems? Tell your prescriber if, to the best of your knowledge, you or someone in your family has ever had any mental illness, including depression, suicidal behavior, or psychosis. Psychosis means a loss of contact with reality, such as hearing voices or seeing things that are not there. Also, tell your prescriber if you take medicines for any of these problems. Stop using Accutane and tell your provider right away if you start to feel sad or have crying spells. Lose interest in activities you once enjoyed. Sleep too much or have trouble sleeping. Become more irritable than usual. Have a change in your appetite or body weight. Have trouble concentrating. Withdraw from your friends or family. Feel like you have no energy. Have feelings of worthlessness or inappropriate guilt. Start having thoughts about hurting yourself or taking your own life, suicidal thoughts. What is Accutane? Accutane is used to treat the most severe form of acne, nodular acne, that cannot be cleared up by any other acne treatments, including antibiotics. In severe nodular acne, many red, swollen, tender lumps form in the skin. These can be the size of pencil erasers or larger. If untreated, nodular acne can lead to permanent scars. However, because Accutane can have serious side effects, you should talk with your prescriber about all of the possible treatments for your acne, and whether Accutane's possible benefits outweigh its possible risks. Who should not take Accutane? Do not take Accutane if you are pregnant, plan to become pregnant, or become pregnant during Accutane treatment. Accutane causes severe birth defects. All females should read the section "What are the important warnings for females taking Accutane?" for more information and warnings about Accutane and pregnancy. Do not take Accutane unless you completely understand its possible risks and are willing to follow all of the instructions in this medication guide. Tell your prescriber if you or someone in your family has had any kind of mental problems, asthma, liver disease, diabetes, heart disease, osteoporosis, bone loss, weak bones, anorexia nervosa, an eating disorder where people eat too little, or any other important health problems. Tell your prescriber about any food or drug allergies you have had in the past. These problems do not necessarily mean you cannot take Accutane, but your prescriber needs this information to discuss if Accutane is right for you. How should I take Accutane? You will get no more than a 30-day supply of Accutane at a time. To be sure, you check in with your prescriber each month to discuss side effects. Your prescription should have a special yellow self-adhesive sticker attached to it. The sticker is yellow. If your prescription does not have this yellow self-adhesive sticker, call your prescriber. The pharmacy should not fill your prescription unless it has the yellow self-adhesive sticker. The amount of Accutane you take has been specially chosen for you and may change during treatment. You will take Accutane 2 times a day with a meal, unless your prescriber tells you otherwise. Swallow your Accutane capsules with a full glass of liquid. This will help prevent the medication inside the capsule from irritating the lining of your esophagus, connection between mouth and stomach. For the same reason, do not chew or suck on the capsule. If you miss a dose, just skip that dose. Do not take 2 doses the next time. You should return to your prescriber as directed to make sure you don't have signs of serious side effects. Because some of Accutane's serious side effects show up in blood tests, some of these visits may involve blood tests. Monthly visits for female patients should always include a urine or serum pregnancy test. What should I avoid while taking Accutane? Do not get pregnant while taking Accutane. C. What is the most important information I should know about Accutane, and what are the important warnings for females taking Accutane? Do not breastfeed while taking Accutane and for 1 month after stopping Accutane. We do not know if Accutane can pass through your milk and harm the baby. Do not give blood while you take Accutane and for 1 month after stopping Accutane. If someone who is pregnant gets your donated blood, her baby may be exposed to Accutane and may be born with birth defects. Do not take vitamin A supplements. Vitamin A in high doses has many of the same side effects as Accutane. Taking both together may increase your chance of getting side effects. Do not have cosmetic procedures to smooth your skin, including waxing, dermabrasion, or laser procedures, while you are using Accutane and for at least 6 months after you stop. Accutane can increase your chance of scarring from these procedures. Check with your prescriber for advice about when you can have cosmetic procedures. Avoid sunlight and ultraviolet lights as much as possible. Tanning machines use ultraviolet lights. Accutane may make your skin more sensitive to light. Do not use birth control pills that do not contain estrogen, minipills. They may not work while you take Accutane. Ask your prescriber or pharmacist if you are not sure what type you are using. Talk with your doctor if you plan to take other drugs or herbal products. This is especially important for patients using birth control pills and other hormonal types of birth control because the birth control may not work as effectively if you are taking certain drugs or herbal products. You should not take the herbal supplement St. John's wort because this herbal supplement may make birth control pills not work as effectively. Talk with your doctor if you are currently taking an oral or injected corticosteroid or anticonvulsant seizure medication prior to using Accutane. These drugs may weaken your bones. Do not share Accutane with other people. It can cause birth defects and other serious health problems. Do not take Accutane with antibiotics unless you talk to your prescriber. For some antibiotics, you may have to stop taking Accutane until the antibiotic treatment is finished. Use of both drugs together can increase the chances of getting increased pressure in the brain. What are the possible side effects of Accutane? Accutane has possible serious side effects. Accutane can cause birth defects, premature births, and death in babies whose mothers took Accutane while they were pregnant. C. What is the most important information I should know about Accutane, and what are the important warnings for females taking Accutane? Serious mental health problems. C. What is the most important information I should know about Accutane? Serious brain problems. Accutane can increase the pressure in your brain. This can lead to permanent loss of sight, or in rare cases, death. Stop taking Accutane and call your prescriber right away if you get any of these signs of increased brain pressure, bad headache, blurred vision, dizziness, nausea, or vomiting. Also, some patients taking Accutane have had seizures, convulsions, or stroke. Abdomen, stomach area problems. Certain symptoms may mean that your internal organs are being damaged. These organs include the liver, pancreas, bowel, intestines, and esophagus connection between mouth and stomach. If your organs are damaged, they may not get better even after you stop taking Accutane. Stop taking Accutane and call your prescriber if you get severe stomach, chest or bowel pain, trouble swallowing or painful swallowing, new or worsening heartburn, diarrhea, rectal bleeding, yellowing of your skin or eyes, or dark urine. Bone and muscle problems. Accutane may affect bones, muscles, and ligaments and cause pain in your joints or muscles. Tell your prescriber if you plan vigorous physical activity during treatment with Accutane. Tell your prescriber if you develop pain, particularly back pain or joint pain. There are reports that some patients have had stunted growth after taking Accutane for acne as directed. There are also some reports of broken bones or reduced healing of broken bones after taking Accutane for acne as directed. No one knows if taking Accutane for acne will affect your bones. If you have a broken bone, tell your provider that you are taking Accutane. Muscle weakness with or without pain can be a sign of serious muscle damage. If this happens, stop taking Accutane and call your prescriber right away. Hearing problems. Some people taking Accutane have developed hearing problems. It is possible that hearing loss can be permanent. Stop using Accutane and call your prescriber if your hearing gets worse or if you have ringing in your ears. Vision problems. While taking Accutane you may develop a sudden inability to see in the dark, so driving at night can be dangerous. This condition usually clears up after you stop taking Accutane, but it may be permanent. Other serious eye effects can occur. Stop taking Accutane and call your prescriber right away if you have any problems with your vision or dryness of the eyes that is painful or constant. Lipid, fats and cholesterol in blood problems. Many people taking Accutane develop high levels of cholesterol and other fats in their blood. This can be a serious problem. Return to your prescriber for blood tests to check your lipids and to get any needed treatment. These problems generally go away when Accutane treatment is finished. Allergic reactions. In some people, Accutane can cause serious allergic reactions. Stop taking Accutane and get emergency care right away if you develop hives, a swollen face or mouth, or have trouble breathing. Stop taking Accutane and call your prescriber if you develop a fever, rash, or red patches or bruises on your legs. Signs of other possibly serious problems. Accutane may cause other problems. Tell your prescriber if you have trouble breathing, shortness of breath, are fainting, are very thirsty or urinate a lot, feel weak, have leg swelling, convulsions, slurred speech, problems moving, or any other serious or unusual problems. Frequent urination and thirst can be signs of blood sugar problems. Serious permanent problems do not happen often. However, because the symptoms listed above may be signs of serious problems, if you get these symptoms, stop taking Accutane and call your prescriber. If not treated, they could lead to serious health problems. Even if these problems are treated, they may not clear up after you stop taking Accutane. Accutane has less serious possible side effects. The common less serious side effects of Accutane are dry skin, chapped lips, dry eyes, and dry nose that may lead to nosebleeds. People who wear contact lenses may have trouble wearing them while taking Accutane and after therapy. Sometimes, people's acne may get worse for a while. They should continue taking Accutane unless told to stop by their prescriber. These are not all of Accutane's possible side effects. Your prescriber or pharmacist can give you more detailed information that is written for healthcare professionals.